1. Which of the following best describes the primary purpose of the NCTRC certification? A. To regulate the scope of practice of all healthcare professions. B. To establish professional competency standards in therapeutic recreation. C. To provide licensure for recreation therapists in every state. D. To set national standards for nursing care delivery. 2. The NCTRC exam blueprint is primarily based on which type of professional framework? A. Job analysis study. B. Theoretical research models. C. State legislation guidelines. D. Recreational facility policies. 3. Which of the following is considered a required component of the NCTRC application process? A. Documentation of CPR certification. E. Completion of a professional portfolio. C. Academic coursework in therapeutic recreation. D. Submission of 3 professional references. 4. The NCTRC exam is designed to evaluate competence in which of the following domains? A. Clinical medicine, nursing, and therapy techniques. B. Knowledge of clients, practice of TR, and organization of services. C. Psychology, psychiatry, and physical rehabilitation. D. Sports, wellness, and physical education. 5. Which of the following most closely aligns with the eligibility requirements for NCTRC certification? A. Bachelor's degree with a concentration in therapeutic recreation. B. Associate degree in recreation management. C. High school diploma and work experience. D. Master's degree in physical therapy. 6. Which of the following is a primary responsibility of NCTRC as a credentialing body? A. Advocacy for recreation therapy licensure. B. Development and administration of certification exams. C. Accreditation of universities offering TR programs. D. Management of recreational facilities. 7. Which of the following is an example of a direct client service activity recognized by NCTRC? A. Planning a hospital holiday party. E. Conducting a leisure education session. C. Designing brochures for TR awareness. D. Attending an administrative staff meeting. 8. The NCTRC exam is administered using which format? A. Paper-based, multiple choice. B. Oral interview with clinical case studies. C. Computer-based multiple choice. D. Practical demonstration of skills. 9. What is the minimum score required to pass the NCTRC exam? A. 55. B. 65. C. 70. D. 75. 10. Which of the following best describes continuing education requirements for CTRS renewal? A. 50 hours of continuing education every 3 years. B. 100 hours of continuing education every 5 years. C. 50 hours of continuing education every 5 years. D. 25 hours of continuing education annually. 11. When applying through the professional equivalency pathway, which is required by NCTRC? A. Minimum of 5 years full-time TR experience. B. State licensure in therapeutic recreation. C. National exam waiver. D. Supervised volunteer service hours. 12. Which of the following client assessment areas is emphasized in NCTRC exam content? A. Leisure functioning. B. Insurance eligibility. C. Hospital administration. D. Community zoning. 13. The role of NCTRC in protecting the public is primarily achieved through A. Establishing minimum competency standards for TR practitioners. E. Reimbursing TR services directly. C. Regulating hospital recreation departments. D. Providing legal representation for CTRSs. 14. Which of the following is a disciplinary action NCTRC may take against certificants? A. Suspension of certification. B. Loss of state license. C. Termination of employment. D. Deduction of clinical privileges. 15. Which of the following best defines the term CTRS? A. Certified Therapeutic Recreation Specialist. B. Clinical Therapy and Rehabilitation Specialist. C. Certified Training and Recreation Supervisor. D. Certified Therapeutic Rehabilitation Scientist. 16. Which of the following is considered a continuing professional education category by NCTRC? A. Volunteering at community events. B. Attending TR-related workshops or conferences. C. Supervising staff at a recreation facility. D. Reading leisure magazines. 17. The NCTRC exam primarily measures competence through A. Case study analysis. B. Multiple choice questions. C. Essay questions. D. Oral presentations. 18. Which of the following is a major content domain of the NCTRC exam? A. Foundational knowledge. B. Pharmacology. C. Business administration. D. Sports management. 19. To be eligible for NCTRC certification, fieldwork experience must be A. A minimum of 14 weeks and supervised by a CTRS. B. A minimum of 6 weeks under any healthcare provider. C. Completed only in a hospital setting. D. Substituted by classroom training. 20. Which of the following best describes the mission of NCTRC? A. To advance recreation therapy research. B. To protect the public by ensuring qualified TR professionals. C. To accredit therapeutic recreation programs. D. To license all recreation-related occupations. 21. Which of the following continuing education activities would not be accepted by NCTRC? A. Academic coursework related to TR. B. Presenting at a professional TR conference. C. Watching unrelated entertainment videos. E. Completing online TR workshops. 22. What is the standard certification cycle length for a CTRS? A. 2 years. B. 3 years. C. 5 years. D. 10 years. 23. Which of the following statements about recertification is correct? A. It is optional for CTRSs after the first cycle. B. It is required to maintain the CTRS credential. C. It requires retaking the national exam every time. It only applies to those with equivalency pathways. 24. Which of the following is the role of NCTRC in the healthcare system? A. Credentialing and standard setting. B. Direct client care. C. Hospital administration. D. Insurance reimbursement. 25. Which of the following is a benefit of holding the CTRS credential? A. Guaranteed state licensure. Recognition of professional competence. C. Automatic salary increase. D. Waiver of liability in malpractice cases. 26. Which of the following client groups is most often referenced in NCTRC exam content? A. Individuals with physical disabilities, mental health needs, or aging concerns. B. Professional athletes. C. Recreational facility staff. D. Hospitality industry workers. 27. Which of the following is a legal or ethical obligation for CTRSs as defined by NCTRC standards? A. Protecting client confidentiality. B. Setting health insurance premiums. C. Determining hospital budgets. D. Conducting community fundraising. 28. Which of the following documentation practices aligns with NCTRC exam competencies? A. Charting client progress using SOAP notes. B. Writing personal journals. C. Drafting grant applications. D. Creating facility marketing flyers. 29. What is the purpose of the NCTRC job analysis study? A. To update the exam content outline. E. To determine state funding allocations. C. To recruit CTRS candidates. D. To certify recreational facilities. 30. Which of the following is required to maintain CTRS certification in good standing? A. Payment of annual dues and fulfillment of recertification requirements. B. Passing a new exam every 2 years. C. State licensure in all 50 states. D. Employment in a hospital setting. 31. The NCTRC exam is accredited by which organization? A. National Commission for Certifying Agencies, NCCA. B. American Hospital Association. C. Centers for Medicare and Medicaid Services. D. National Recreation and Park Association. 32. Which of the following is not a focus of the NCTRC exam? A. Professionalism and ethics. B. Client assessment. C. Recreational facility construction. D. Implementation of TR interventions. 33. Which of the following accurately describes the NCTRC equivalency pathway? A. Recognition of professional experience as partial qualification for certification. B. Automatic exemption from exams for all experienced practitioners. C. A separate exam for non-degree candidates. D. A program for international candidates only.